Good afternoon, everyone. This is Alex Samuel, Director of the Chesterfield Health District. If anyone has been following the data on the VDH website or listening to the news, you've noticed a significant increase with current 7-day averages of around 90 new cases per day in the county right now. This is a new high for us. Some of these cases can be attributed to large institutional outbreaks at a few long-term care facilities, but most, however, are due to exposures from workplace exposures or small social gatherings. Anecdotally, we're hearing about exposures related to recent Thanksgiving holiday gatherings, and it's really pretty hard right now to quantify that category of cases compared to other types. However, by and large, we're truly seeing signs that we're following suit with national and statewide trends, and that this increase or spike in cases isn't an aberration or due simply to increases in testing. Percent positivity values, which we've talked about in the past, and are really a crude index of community spread, are right now at 9.4% for this health district. And again, this health district includes the city of Colonial Heights, Powhatan County, and Chesterfield County. And to put that in some perspective, the statewide percent positivity rate right now is around 9.5%. And for Chesterfield County, it's at 9.3%. So we're pretty up there. Remember, we want to stay below 10%, but we've been drifting and inching upward in this direction from a value of around 6% in early November. So again, this truly is not something that is an aberration or a passing spike. I think we're truly seeing an increase of concern. So what does all of this mean? Essentially, that the virus is spreading quite rapidly as cooler weather and shorter daylight hours are bringing people indoors and closer to one another. Again, our primary way to address, and I keep banging this drum every week, our primary way to address this hasn't changed. And we must continue to practice the preventive practices that work, like wearing a mask or face covering when indoors or at work, especially indoor public spaces, maintaining 6 feet of social distance, washing one's hands frequently, and of course, staying home if you're sick. And it's critical to remember that these measures are aimed at protecting those who are at greatest risk of experiencing serious outcomes, like hospitalizations or even death. And that includes older adults as well as those with underlying health conditions, like diabetes, cancer, heart conditions, among others. And again, I referred to this earlier. We've had a couple of large outbreaks in long-term care facilities during the month of November with several fatalities. And what we have noticed in the past, this is not just unique to us, this is a nationwide trend. You know, as we're seeing more community transmission, as we're seeing more cases in the community, we are sadly seeing more cases in places where we specifically don't want to see them, such as long-term care facilities. Indicative, again, of the fact that, you know, this virus has penetration, even in places where there are relatively stringent or strict mitigation efforts in place. So what I do want to do is switch gears and talk a little bit about the subject of vaccinations. There's been a lot of new information about vaccines and vaccine availability that's come out over the past 2 weeks. You know, I'm sure everyone is aware that Operation Warp Speed has been working for the past several months, and there has been progress on the front of vaccine development. It's critical to note that every phase of normal vaccine development took place, even though it was sped up. No corners were cut, no testing steps were omitted, no compromises were allowed in safety, quality, or efficacy standards. The key to success with Warp Speed was 100% industry focus on this one problem. So this was really an all-out effort to develop a vaccine that, you know, harkens back to World War II, I believe that is typically the analogy that has been made. So some of the major differences is the accelerated pace of the manufacturing, which normally does not occur until after a vaccine receives FDA approval. So vaccine production has already started, and the candidates, many of them, there are several of them, went into major production early in the testing process. So the cost for possible financial loss to companies has been covered by the U.S. government, which of course has allowed for a lot of innovation and risk-taking on the part of vaccine companies. And risk-taking, by this I mean the risk to develop vaccines relatively quickly as a business venture. So right now, Pfizer and Moderna, two pharmaceutical companies, have produced vaccines that have really pretty remarkable efficacy or effectiveness ratings. Both are claiming near 95% protection in trials that have been done so far. Now, to put that in perspective with flu vaccine, we consider a good year for a flu vaccine to be around 50 to 55% effective. So to have a vaccine that's 95% is really a good thing. We are still waiting formal FDA approval for both of those vaccines. They have requested that from the FDA. It is expected within the next 10 to 15 days. And in terms of offering these vaccines, these are, again, two of multiple, and we do expect to have more available over time. The plan with respect to offering them is that they would be offered in phases. Initial phase 1, would be aimed at priority populations, simply because it's expected that there won't be a whole lot of vaccine available in the very early phases, again, as production and distribution ramp up to meet demand. So all of the development and national distribution plans have been, of course, developed by the federal government. Here within Virginia and other states, of course, states have developed their own vaccine distribution planning schema as well. So I want to cover a little bit with regard to the vaccination availability timeline, which is somewhat subject to change, but here's what we know so far. Of course, I mentioned earlier that very recently both Pfizer and Moderna requested FDA as well as CDC approval for the vaccines. Just day before yesterday, the Advisory Committee on Immunization Practices, which is a national scientific review board, defined the first vaccine recipient populations. These are the first phase, or actually within the first phase, the very first phase of first phase, phase 1A. And these were indicated as individuals who are healthcare workers and residents of long-term care facilities. This is a recommendation, I should make clear, from that advisory committee, ACIP for short. We are expecting to get confirmation of those two groups that I mentioned relatively soon. On December the 10th, the FDA is expected to approve the Pfizer vaccine. And then very shortly after, in fact, the next day, we're expecting on December 11th that hospitals will begin receiving some early doses of the Pfizer vaccine, and hospitals in particular because they have the capacity to store this vaccine, which requires ultra cold storage. We're talking in the range of minus 70 degrees Fahrenheit. So obviously, specialized refrigeration equipment, freezer equipment is needed for that. Between December 10th to 17th, we expect CDC endorsement of the vaccine, and then right after that, vaccination should begin with additional vaccines as they come online, being reviewed, approved, and then shipped out. So what does all of this mean to us? What can the general public expect? Again, as I mentioned earlier, these vaccines will come out in phases, and still there is fine print and areas to be defined with regard to these phases. Phase 1, again, is likely to include in it the very first group, healthcare providers, long-term care facility residents and staff. Then the next phase within phase 1, or phase 1B, currently considered essential workers. The exact definition of what exact essential worker means is to be determined yet. And then phase 1C, the final phase within phase 1, we believe right now would be individuals with high-risk medical conditions, but certainly more on that to come as we gain clarity. We, however, expect that for the public in general, the phase 2 will likely be when vaccine is available for the rest of us. And right now, the thinking is that could potentially be mid to late winter. We're thinking February to March of 2021. So what's also important to note is that the current vaccines, the Pfizer as well as the Moderna, and probably some of the early newer vaccines that come out after them will require a 2-dose sequence. For the Pfizer vaccine, the first and second doses will be separated by 21 days. And then for the Moderna vaccine, the first and second doses will be separated by 28 days. And it's important that these vaccines simply can't be mixed and matched. If you get a dose 1 of Pfizer, you need dose 2 of Pfizer. And likewise with the Moderna vaccine, that's true as well. So, all of this to say that there is, again, much to be refined and clarified with time. More updates, of course, will come. We do believe with respect to distribution of vaccine during phase 1 at least, more than likely hospital systems will take the lead with vaccinating healthcare workers, and it is our understanding that pharmacy systems will have a huge role in vaccinating residents of long-term care facilities, as well as workers in long-term care facilities. So I'll sort of end there with regard to vaccinations. Again, things are right now coming into focus. But much of what I've shared, I keep offering this as a caveat, is provisional right now, but likely to change. So I thank you again for your attention and patience. I trust that you will continue to practice vigilance. The 3 W's that we mention every week: wear face covering, watch your distance, wash your hands, and continue to express my interest that you maintain healthy and safe. And until the next time, thank you very much.